Oh yeah, I just did. I just realised that.
Thank you to Roya and Manish, who have already put in the chat their hellos and where they're from. If I'd like to encourage everyone who's comfortable to do that, it will really help us see from where we are all in the world. Okay, I might get going because my part is perhaps the least important in terms of our discussion, although it is my very great pleasure to welcome you all to this discussion tonight. And I would also like to, as well as welcome you, acknowledge the traditional owners of lands we're joining from. For me, this is the Wurundjeri people, and for my colleague Shamadeep, this is the Gadigal people. I pay my respects to elders past and present and extend this respect to First Nations people everywhere. It's with great admiration and respect I acknowledge their enduring connection to land, sky, waters, culture, and community. So the idea for this event has existed for many months, yet as time went on, the list of questions in our minds not only remained unanswered, but it grew. Recognizing the need to bring together different perspectives, a few weeks ago, Shomedi, I connected and sought to find out whether or not we could pull together some experts in a window of time that existed, and it's just meant to be that we were able to find such excellent speakers as we have tonight. And I know that we have a long list of questions from registrants as well, so I'm not sure that we might get through all of them, but we'll do our very best. And I think perhaps we might even need to think about some further discussions. So I realize I may not have even introduced myself. My name's Marinka and I lead the Global Thought Leadership Program here at the George. And to get into the next part of our discussion, I'd like to introduce our facilitator for tonight, Dr. Shomadeep Balmik, who is the head of the Meta Research and Evidence Synthesis Unit at the George. And Dr. Shomadeep has been working in this area as well as a lot of others for a while now. So I was very excited that he would be happy to bring us together in this discussion tonight. Shomadeep, I'll hand over to you. Thank you.
Thank you, Marinke. It's my great privilege to moderate this session with such a wonderful panel of speakers. So we are talking, the subject matter today is the moral code, the ethics of using AI for health research. So AI kind of launched itself on our lives quite suddenly, and it has been used across sectors, and clearly ethics and governance around that needs to catch up in a lot of different ways. So we have been trying to explore what are the issues, but broadly we are also focusing a lot on what good governance of AI for health research looks like, so that we can maximize the benefits from using AI, as well as minimize the risks, as well as the long-term societal impacts, which might be positive or negative in nature. So the idea behind this is to have a really great global spread of experts on this domain, with both lived experience, technical expertise, working across policies, and I will tell you more about them. So that's what we will be doing. And I'm really glad that there are more than 140 people joining online and several people across the 4 hubs of our offices. So thank you for joining us. So the format today is largely that there will be 2 sets of keynote speakers. After these 2 keynote speakers, there will be a 5-minute quick questions. And so please keep the question and answer coming. And after the 4 keynotes are delivered, we will have a around 15 minutes to ask any more questions you might want to ask. So while I do uh, uh, introduce my next speaker, I've just launched in a poll. So asking two questions: do you use AI for health research? And are you concerned about the ethics of AI use in health research? So if you can, those joining online, if you can quickly uh, look at it, it will be really uh, good. Okay, so I'll just close the poll. In the meantime, I will introduce our first keynote speaker, Caitlin Alsop. So Caitlin is a sepsis survivor, educator, and a passionate advocate for patient voices in healthcare. At 23 years of age, she survived a life-threatening sepsis episode that left her in coma for 9 days. Since then, she has dedicated her life to raising awareness and improving education around sepsis. And Caitlin has worked extensively, especially on the Face Sepsis project in partnership with Sepsis Australia, and created courage cards to honor survivors and families across the world. And we are very lucky that Caitlin is working with us and helping us understand consumer viewpoints. But she has also worked across Sepsis Australia, World Health Organization, and Queensland Health and New South Wales Health in Australia. So she's a real voice of consumers, and she will be talking about uh, consumer perspectives uh, on uh, and considerations in AI. So I'll just end the poll very quickly and share the results. I'm sure you all can see it. So looks like almost 50% of the people are using AI for health research. And some people are not researchers, which is really good to know that other people are also interesting. So we really want to hear your viewpoints. But there's a big concern around 93% people who actually are really concerned about the ethical and moral dimensions of it. And this is the reason we think this is an important area to discuss around and have these aspects discussed. So I will now hand over to our first expert with lived experiences, Caitlin Alsop, a consumer perspective and considerations in AI. Thank you.
Thanks, Shamideep, and it's lovely to be here with everyone just to share a bit about my experience as a consumer working in AI in sepsis and also what it's been like as a consumer in general in medical and health research, and also part of my role being on the Consumer and Community Involvement Program of the George Institute. So I'm really passionate about research and what we can do. And I think AI is really starting to shape what we can do as well. So I'm just going to share my screen. So I'll get straight into it because I know we do have limited time. And when I was thinking about this presentation and what we could potentially learn from AI and what it's like as a consumer and as researchers working with AI, the image of WALL-E came to my mind. And I know it's a little bit unconventional, but I remember this quote from the WALL-E movie. And some of you may or may not remember this. And see, that's the thing, right? It's actually not from the WALL-E movie. This is actually an image that I generated with AI myself. And so AI is this magical tool that we have to enhance what we do and capture so much. But at the same time, I think it really shows the danger of using AI and that we need to make sure that we're bringing the human element into artificial intelligence. So that's what I'm going to be talking about today. So, like mentioned, I am a sepsis survivor and consumer working on various programs at the George Institute and a lot of different programs across the world and across Australia. One of those projects is actually an AI project, and I am not the brains behind that. However, it has opened my eyes up to what it's like to work with AI. And now I'm working as a senior project officer for the Consumer and Community Involvement Program. So I'll be talking to you a little bit about the consumer lens, but also what we need to consider when we are involving consumers as well. This presentation will be really about my personal roles and my personal thoughts. But I think when we really look at AI and research in general, it's a constant journey of learning. And that's the beauty of research, because we are all constantly learning and learning together. So involvement is evolving, is probably the way that I would summarize consumer and community involvement and how that engages with AI and future research. So originally it started off informing people about what we're going to be doing through research, and we're moving further and further up the ladder to partnering with people. So making sure that what we do is actually led by community needs, working together, and eventually getting to that consumer-led aim, which is basically making sure that what we're talking about, what we're doing, is reflecting what community needs are and what community wants. And the most important way to do that is to make sure that we have diverse voices, which is something that we're always working towards. So people often say to me, why involve consumers? My journey started off as a consumer. As you heard, I had septic shock, and then became really passionate as a community member about what changes we could make. And that's the thing, consumers bring a unique perspective to every single aspect of health and medical research, and to every aspect of the health and medical system. So I've had so many conversations with people who have said, we saw it this way and it completely changed the scope of that research. And so consumers also bridge that gap between research and the real world implementation of what we can do. Ensuring that focus and work also meets community needs and delivers impact is paramount. And when you involve consumers, you involve members from community, you involve consumers, those impacted by what you're actually researching, you then begin to be able to understand how that is going to impact them. It's really important at the end of the day that what we're focusing on is that impact. Or what I've really noticed in some of my own roles is consumers see things that are often missed, and they also voice things that need to be spoken. So, you know, when we're working so hard on something, it's so easy to accidentally end up with that tunnel vision. Myself and someone who's absolutely done that, and having that perspective of looking at it from a different view can really change what we're doing. And I think it's really important that we consider that when we are talking about machine learning, artificial intelligence, and what it is that we actually teach these machines. So my experience, well, when I was asked about using AI in my role as a consumer, I sort of look back at it as that Wall-E picture and think it's a journey into the unknown. It's constantly evolving. And I think it's important that we all evolve with it together. So the project that I'm currently working on, sepsis algorithm, there's an incredible team which is focusing on making an impact. And when I was asked to join this project, I thought, wow, you might be able to change the diagnosis of sepsis and save lives. Absolutely, I'm in. But also on that project, I thought, what is it that we need to consider? And so some of the things that I've been talking about are things like, are patients okay with what we're doing? Are people fully able to consent to what it is that we're doing? And do we have the right lens in what we're currently doing? And I think it comes down to how do we bridge the gap between developing technology, creating impact, and doing this morally and ethically. So considerations have been about public trust. So often one of the things that we fear is the unknown, and that's the thing about AI, it's unknown. And so when you involve consumers in developing and shaping AI, you start to signal transparency and accountability, which is really important because that helps to build public trust. It lets people feel represented and their concerns start to be addressed. And what about consent and privacy? I mean, ethics in AI means respecting autonomy. And so it's really important that consent is informed and not assumed. Is it simple language? Do people understand how the data is being used? And what happens when things go wrong? Consumers help anticipate what the unintended consequences can be. So reinforce bias, assumptions, inequalities, and what do we need to consider to mitigate the risk, to be accountable and develop public trust? That's the power of working together. So from this actual Wall-E quote, the future is in our hands. It's not just about AI, but it's about collaboration, acknowledging what we don't know and working together as researchers and consumers, so we can deliver ethical, moral research that focuses on impact and public trust. So consider, what would it look like if consumers were at the table for every single AI project? Thank you.
Thank you so much, Caitlin. And I think you have hit the nail on actually a good triangle that comes up, which is the triangle of balancing developing technology, creating impact, and doing things morally and ethically. It's quite a useful framework, I think. So, Caitlin told us about the consumer perspectives and concerns, and the group that, or the institution, or the governance mechanism to address this is institutional ethics committees. So, Dr. Anand Bhan, a researcher in global health, bioethics, and health policy, working with Sangat, and also an adjunct professor at the Unipova University in India, will be talking about the implementation in institutional oversight in AI for health research and the challenges for ethics committees. So before he talks about it, I will just add a bit more about Dr. Bhan. So Dr. Bhan is the former president of the International Association of Bioethics, and he has contributed to innumerable number of global ethics initiatives. Uh, right from WHO and more recently in the COVID-19 ethics committees, as well as guideline development groups for the Council for International Organization of Medical Sciences, as well as the WHO Global Forum for Bioethics and Research. So extensive experience, and over to you, Dr. Bhan, for the next keynote. Thank you.
Thank you, Soumya. I appreciate the opportunity to be part of today's conversation, and I think we are all already learning. Thank you so much, Caitlin, for sharing what is an extremely important perspective that we usually miss out on. So when I was asked to speak on institutional ethics committees and sort of their intersection with AI use in health research, I thought maybe I'll start with my own perspectives, right? And my perspectives come from a place where whether one likes it or not, one ends up becoming a user of AI, right? And if you look at the chat window today, you'll see that there are at least 4 colleagues who've joined today who have been introduced by their AI health assistants. So, I mean, it sort of pervades all parts of our life, doesn't it? But I am also a researcher, and some of the work that we do also uses AI. And so, I mean, there's that part of my professional journey. And of course, the more relevant one would be the one where I have been an ethics committee member, and I've been part of meetings where we have tried to review AI-based health research projects, and that's what I will try to bring to the table. I also want to point out that when we say AI health research and challenges, it's important to remember that from an ethics committee perspective or an ethics review perspective, we've dealt with many similar challenges because technology has evolved such a lot, right? And so some similar questions have also been raised when for newer forms of technology, whether that be omics, whether that be gene editing, CRISPR, whether that be precision medicine, whether that is increasing use of digital spaces for health research. So it's not necessarily the case that everything is unique about what we're talking about AI and the challenges it brings, but it's important to remember and of course acknowledge the kind of challenges which are there. Now, the first issue which comes up when one tries to envisage the use of AI in health research is, can't ethics committees themselves use AI, right? And it makes a lot of sense. And I think those arguments have been made because sometimes the process is so bureaucratic, the process takes too much time, there is so much paperwork to have to review and to go through, etc., right? So even at the secretariat level, in terms of initially looking at the submissions, the initial review, making sure all of the documents are in, all of the key aspects have been filled, to potential deployment during the review process, right? In terms of flagging any key ethical issues, identifying any key milestones. For example, if you have annual reports due, you have an end of study report due, etc. Note taking in minutes. You know, in many of our regular Zoom calls or conversations, you already have AI health assistants being used. Of course, there are downsides, right? Because one considers the ethics review process to be a confidential process. So if you have AI tools being part of that, how would that impact confidentiality of the information and the documentation? There's also the risk of automation bias, which is to say that as increasingly more and more of us get very reliant on AI tools, will we just basically rely on AI to do our work, right? And would that take away from a more philosophical engagement on ethical issues in health research? And of course, dual use. You know, if you have tools, then even applicants can use those tools to try to anticipate what kind of questions might be there from health research ethics committees and try to already respond to those. Now, specifically for ethics committees who are reviewing AI in health research, one of the key challenges certainly is expertise. And this is because the tools, their application, the way data is leveraged, the way outputs emerge, and any kind of associated risks of the use of AI in health research, many ethics committees struggle with understanding that, right? Now, usually the benefits are some things that the applicants will very clearly lay out in the application. And of course, everyone wants to push the idea that I want to use AI in health research. So that is usually a more clearer, tangible, information that you can deal with. But the risks are often unknown. And that is where I think ethics committees often struggle because they don't necessarily always have the expertise to understand. The second important aspect related to that is that the field is evolving at such a rapid pace, right? You have newer tools being released almost every couple of months. Sometimes within the same month, you have multiple releases. And it's difficult to keep track as to what are the newer elements of the tools that we are dealing with, right? We also know that AI is already being used in writing up even scientific protocols, paper manuscripts for submission, and likely even ethics committee submissions, right? And this is just beyond its use in health research. I also feel that when you sit on an ethics committee, you sometimes get this impression that everyone wants to now do something with AI, right? So if I am a potential researcher or a faculty member in an institution, I almost get this feeling that people are getting this feeling of, a fear of missing out. That if I don't do something in AI, maybe I'm not doing innovative research, right? And so you have a plethora of submissions which come in this area. Now, a lot of these submissions also end up having external collaborators. Sometimes they are domestic, sometimes they are international. They are the technical folks who bring in the expertise, especially for health research. So these might be from a technology institution or an AI company, and that by itself can bring unique ethical issues. Now, if we envisage the role of the ethics committee to be primarily about protecting research participants, the key question is, do they feel confident in being able to do so, right? And if they have to do that, then how do they ensure in documentation, for example, like consent forms, that there is actually an accurate depiction of what AI usage in health research involves, how the data that we are taking from the participants or the patients would be used, in what algorithmic analysis would that be deployed. Now, there is usually a lot of opacity in some of the AI algorithms. So how do you even ensure that that is accurately depicted? Where would this data be stored? Who would have the ability to access it? For what all purposes it might be potentially used? And for how long would it be potentially used? And is there even a guarantee that at some point of time we can stop the usage of that data, right? Because once it's part of the algorithm, do you have any sense of control, right? Now, part of where we struggle, of course, is that the various stakeholders involved in this ecosystem are not necessarily understanding each other very well, right? It's not just that the ethics committees don't understand the technology and the evolving nature of it and struggle with it. It's also that the developers sometimes don't understand the key ethical requirements and why is it that we have to do this? Why is it that we have to ensure privacy and confidentiality, etc., right? So that conversation needs to go beyond much the focus on ethics review to really a more fundamental conversation around why is it that ethics needs to be a key part of the way we develop new technology. As Caitlin was saying, part of the challenge even in ethics review is that we don't really get sometimes key stakeholder inputs. You might have the layperson on an ethics committee or the community member, but I don't see that as necessarily really representing the kind of wide range of voices we need when we discuss AI use in health research, including patients, consumers, implementers, policymakers. It's also important to remember that often ethics review is reduced to a one-time exercise, right? You get a submission, you review it in detail, and then the following reviews might just be looking at annual reports, etc. But the risks of the AI deployment in health research typically end up evolving, right? And so the one-time assessment format, does that really lend itself to AI use in health research? And do we need to revisit that and reimagine it, right? And that's where maybe a more constant dialogue would be a better approach for ethics review, where you look at algorithm design, how is data annotation happening, what are the kind of further steps which are happening, but is the current ethics review implementation formats really allowing for that, right? And part of the challenge, of course, also is we can say that, one way of trying to understand is to invite an expert, right? A scientific expert. But how many AI domain experts are available for each ethics committee and have the time to provide inputs and look at proposals and be available on a regular basis? Newer AI tools being released, right? This is a constant challenge because if the field is evolving so fast, it would have an impact on ongoing research. Because in ethics, again, if there is any key scientific change which has happened in the field, which could impact your research study, then your ethics committee needs to be informed. Then you might need to revisit your protocol. Then you might need to change your scientific approaches, etc. Is that happening, right? And can that be also tracked? And how can the ethics review ensure that is something to think about? Now, when we talk about AI use, I know there are these larger challenges, right? And I'm sure Rolly and Jerome will speak to this larger question around equitable data representation. How are the algorithms being developed? What data are they leveraging, right? And is there a possibility of bias or only data from a particular set of patients or participants or communities being represented? So how do we ensure diversity of source data is there? And again, do ethics committees have access to that kind of information? The scale of data sets can also be humongous, right? And it could be sometimes country level, sometimes multi-country. That by itself is a challenge. Almost all AI used in health research has some element of a commercialization interlinkage, right? And when you have private entities or a commercialization potential, then it will also raise its own unique ethical issues, right? And sometimes I don't feel ethics committees really are able to focus enough on some of those aspects, and maybe will need some more thinking to be done there. Now, typically, when we talk about AI use in health research, there is, as is often the case, a classical pushback by those who have to submit, that ethics review is becoming a bottleneck. We want to deploy these technologies. These technologies can help in patient care, in public health, in making systems more efficient, in providing information more quickly. But again, given all of the constraints that we are already speaking about, we need to understand why that is happening. And that, again, a more constant conversation would be a way to maybe approach some of these. So given that a lot of these algorithms are black boxes, ECs struggle with understanding application, understanding accountability, there are also underlying fears and concerns. Many of the members of the ethics committee members themselves are clinicians, are scientists, are users of AI. There is this constant fear that what does this really mean? What kind of an impact would this have on patient-centered care? How would an AI algorithm, if that AI algorithm starts taking clinical decisions, what would happen to empathy? Would we be replaced, right? All of that background fear is still there. And I think that's an open debate, right? What is the nature of how AI is going to impact healthcare and public health is something which I think is by itself an evolving larger question. So fundamentally, if I were to leave you with some thoughts, maybe thinking about equity, justice, capacity building, local ownership, being prioritized as primarily the kind of ethical issues that we need to spend more time thinking about, beyond the classical areas of ethics review that we look at, which revolve around risk, benefit, autonomy, consent, etc. And how can we shift maybe to a more integrated, responsive ethics engagement beyond just the one-time ethics review model that is often used in institutions, is something for all of us to think about. And as Stephen Hawking reminded us, that our future is going to be a race between the growing power of technology, which is what we are seeing, and the wisdom with which we are able to use it. So I will leave you with that thought. Thank you for the opportunity to share some insights from my side. Back to you, Soumya.
Thank you so much, Dr. Bhan. I think building up from Caitlin, really good point that with newer technologies coming in, the role of the ethics committees is not just protecting participants, it's much more larger. And also that it's not a static process anymore. There are larger issues around, it has to be more dynamic and more involving of different types of stakeholders in the manner Caitlin talked about. So really complementary talks. So just asking, and if you want us to ask any questions to the panelists, please use the Q&A function Okay, just to get started, I will actually ask Caitlin one question before we go to the next uh, set of keynotes. So, Caitlin, I think what came across from Anand's talk and from yours also, and a lot of questions around this from the people who registered were about bias in AI and what are its implications for equity populations. Uh, and how do you see that playing in terms of public trust, engaging communities in health research, and other aspects?
Yeah, it's a good question. And I think it's something that we're always trying to address in research, and it needs more reach from more diverse voices. So that's the first thing. But when we come to building public trust in the use of AI, I think it comes with the transparency and the accountability that we bring to it. So what we need to be able to do is start to use the machine learning to teach the machines to be better. So pick up where us humans have potentially missed this in previous research, previous studies, and look at how we can actually identify what the gaps are, listen to more voices, and how we can actually build better machines so that we can have better results and start moving towards a more equitable outcomes, and also enhancing more diverse voices as well.
Okay, thank you, Caitlin. If you have any questions, please use the Q&A function. Just checking in if anybody in the Sydney room has any questions. Please raise your hands. We'll go with you with the mic. Or anyone in the Delhi or the Hyderabad or the London office. Oh, I see there's a question. So, Dr. Anand Pan? Yeah.
So this question is for Dr. Pan. Thank you for an excellent talk. You raised some very important concerns about the use of AI. My question was, which AI applications are used currently in ethics submissions? Sorry, I don't know that. I would like to know. And how do they justify not using domain expert AI or something similar? It's definitely concerning. Thank you.
Yeah, so I think a lot of people are using tools like ChatGPT and other similar tools, certainly in developing or getting maybe a review of something that they've written up, right? So they might write up a ethics submission document, for example, but run it through an AI tool just to ensure that it looks through language, etc. Of course, the downside is that unless you do an expert review once the AI tool has gone through your document, that it might end up messing up some stuff, right? But it is certainly being used, and if you speak to any researcher, faculty member, etc., we're increasingly seeing the use of AI tools, especially even from students and early career researchers. The domain expert question, I think the challenge is, who is an AI domain expert, right? First of all, even being able to define that, right? Because just doing a workshop on AI, does that make you a domain expert? Does doing a certificate course make you an AI domain expert? So how do you define who is an AI domain expert? I think is the first challenge. And the second thing is, let's say we are able to establish that, but how many of them are there, and how many of them are willing to serve as an expert resource person for an ethics committee and be available in the remotest parts of various countries like mine, where an ethics committee might be operating, right? And maybe sometimes they can join online, but will they have the time to review protocols in advance of that? And for institutions to allow for confidentiality documentation to be signed, and maybe providing an honorarium for their time, because AI experts are in a major demand, right? So these are all of the kind of practical constraints which I guess we will all be dealing with for the foreseeable future. So that's what I was trying to allude to, that one way of saying that how do we deal with newer submissions which use technologies is to have an expert who is invited to provide in their perspectives. But again, figuring out expertise in AI and making enough experts available is something which will require more thought and efforts. That's what I was trying to say. Thank you.
Thank you so much, Dr. Pan. I see questions are coming in. Please keep them coming in the question and answer. We will take it. I'll now go to the next two set of keynotes. So in the first keynote set, we were looking at things which were much more closer to what we do as researchers or doing health research, the voice of consumers and ethics committees. But now we want to look from the next two set of speakers on a much more macro basis on things which are at a higher level, if I may say, but again, equally important because our society functions at multiple levels and all of these are equally important. So our next speaker is Dr. Roli Mathur. She heads the ICMR Bioethics Unit in Bangalore and is a professor of medical research at the Academy of Science and Innovative Research in India. So she serves as the member secretary of India's Central Ethics Committee and advises the National Ethics Committee Registry. And she has played a key role in shaping a lot of national research ethics policies in India, including the Indian Council of Medical Researchers Research AI ethics guidelines and various global efforts of WHO and CIOMS. So lot of experience, and over to you, Dr. Mathur, for your keynote. Thank you.
Well, thank you so much, Dr. Soumyadeep, for this invitation. And I'm really happy to be talking to the audience today about the ICMR's initiative in this area, because as we know, the promise of AI is significant, but the thing is, this immense promise comes with a huge responsibility for the researchers as well as the ethics committees. And there are a lot of questions that are related to ethics, which are very central to, as we move ahead in the area of getting more and more acceptance for artificial intelligence and its use in medical research as well as healthcare. So only today I saw this new development, so I just put it in my cover slide, and which is that the UN has, come up with this resolution which was passed yesterday and about promoting there are two new mechanisms that have been set up to promote international cooperation around AI, global dialogue on AI governance, and an independent scientific panel on AI. So we see that the whole world is moving ahead because as we are dealing with this technology, we also need to understand the governance issues and how to really make the best use of the technology that is available in our hands today. So ICMR had come up with the guidelines in 2023, and this will be an evolving document. This was an initial document that was prepared for the first time, talking about the ethical issues related to AI use in biomedical research and healthcare. And the whole idea was about trying to think of, because the way the technology is built, growing up so fast, this is a document that aims to build a vibrant ecosystem for social development as well as inclusive growth and have encouraged responsible AI for greater good. And so in the initial part, I'll be discussing what the document is all about, and of course, refer you to download it from ICMR website for your readings. So the first part of the document is talking about what are the probable uses and applications of AI in the area of medical research and healthcare, which is diagnostics, screening, therapeutics, clinical care, epidemiology, behavioral sciences, health management systems, etc. And as we see, there are newer areas that are evolving every day. And then the second part of the guideline, there are 5 sections which are talking about the principles for responsible AI, then the principles for stakeholders who are using the technology, and then the third one is on ethics review processes, the fourth is on informed consent, and fifth is on governance of AI technology. When we look at these principles, and as highlighted by the previous speakers, the ethics committee needs to look at all these things. And it is not only ethics committee, it's actually the developers, the researchers who are going to use AI in developing their tools or using the tools. And so the document has tried to look at some of the basic elements for responsible AI, which is, autonomy, minimizing risk, trustworthiness, data privacy, accountability, optimization of quality, accessibility, equity, inclusiveness, collaboration, non-discrimination, fairness, validity. So all these things have been discussed in the document. And it is very important as we grow along this, we see that, there are challenges, which are that seemingly de-identified data could be re-identified, for example, or there are questions around whether individuals can control how their data is to be used. How do we make sure that the systems are robust, complete, and the systems that are developed are interoperable, that is a huge challenge. And then how do our guidelines actually serve the underserved or representatives, people who are marginalized or who are disadvantaged groups? How can we, target the diversity that exists in our systems? Then we need to make sure that they do not disproportionately benefit a few, a top sector, but ignore certain other groups. There are possibilities of system errors. So how do we make sure there is adequate transparency, audits, methods for oversight, and also to prevent against over-reliance of AI, where we lose the touch, the human touch, and we become over-reliant on AI. And how do we really communicate? There are a lot of these risk benefits. They're not well understood actually, and how options and decisions could be made. What are the accountability mechanisms, and who is accountable? Is the doctor who's using the tool accountable, or is it the company who's developing or the developer accountable? So these are difficult questions. How do you actually go about these and building trust? And of course, we know there are commercial entities and there are commercial interests in play as we go along. So then the next chapter in the document is about guiding principles for stakeholders. So it has tried to list out that as the developers use this, what are the requirements that they should look at? Similarly, those of them who do the validation, what are the requirements that they should look at? And then at the level of deployment. And in the interest of time, I will not be able to go through in detail all these things, but I really urge you to look at the document. And then the next chapter is on ethical review procedures. We heard from Dr. Bhan the challenges that the ethics committee faces. And now we expect a lot from the ethics committee, that they need to ensure scientific rigor and what has been suggested. So some suggestions have been made in the document, like, for example, inviting some external expertise into the committee, such as legal experts who understand a little more about IT and medical law, or how to deal with data, computer scientists, or other subject experts who have, and then also ethics committee to, get some kind of a training or understanding on what exactly this is all about, because only then they will be able to ensure and ask these very relevant questions, like, for example, what are the sources of data and how the quality and bias could be reduced, and what the technology is, what are the appropriate sites, what are the procedures, how participants are going to be protected, and how it's going to be managed, and then whether these algorithms are in public domain, are they available for scrutiny, how are the mechanisms for redressal if there is any harm to anybody, and then how to involve more and more public participation. And we really thank Kathleen for bringing in that perspective into it, how to have the representatives on board in order to protect the public interest. So I just thought, and then the next chapter is on informed consent, and there are a lot of implications, and I'm just bringing in a small case from the WHO guideline that was also released in the same year. And this is for just to show you that, if an AI is being used in a hospital, let's say recommending a particular use of a drug or a dosage, and the physician also doesn't understand that how the AI system has come to this particular dose or the drug use. So there is a difficulty in understanding. And then if the patients are to able to find out that AI is being used, how does a doctor really deal with that? So these kind of case studies are available in this document, and they are very interesting cases, because on one hand, we would like all these elements of informed consent process to be there, but then we must understand there's insufficient knowledge, not only among patients, but also in the medical professionals And a patient is obviously not in a position to understand implications or refuse treatment, and hospitals may or may not inform. We don't have very clear-cut policies at the moment that whether AI is being used and to what extent it is being used. And there is the fear of losing control and surrendering to some commercial entities because, you know, they are the ones who are developing, deploying, and which come to our aid. Then in the last part of the guideline, there's a checklist that has been prepared, which is very helpful actually for anybody who's doing work around AI to just go through and see whether, you know, all these various requirements are getting fulfilled. So it's a initial guide. And I think with that, I'd like to thank you all. And I urge you to visit our website, just Google in ICMR Bioethics Unit to get to our documents and including this ethics document on AI. Thank you very much once again. And happy to take questions if any. Yeah.
Okay, thank you so much, Dr. Mathur. I see that coming with this document in 2023 was a very fast-paced move. So, and it's quite extensive. I will ask you more about that, but I will ask the attendees to type in and use the Q&A function to put in any questions they might have for Dr. Mathur or any of the other panelists. Okay. So our next speaker is Dr. Jerome Amir Singh. He is the director of the Scientific Advisory Group on Emergencies at the Academy of Science of South Africa and is an adjunct professor at the Dalai Lama School of Public Health in University of Toronto. He is a leading voice in global health ethics and governance, and he serves on numerous committees, including the WHO's expert group on ethics and governance of artificial intelligence for health. His work focuses on the intersection of science, ethics, and policies in global health emergencies and emerging technologies. And the right person to talk about the topic of systemic risks and global governance of AI in health research. So thank you so much, and over to you, Jerome.
Thank you so much. I appreciate the introduction, and good morning, good afternoon, good evening, wherever you are. From what I've heard, you spread around the world. And thank you to the organizers for the invitation. So I've been asked to speak on systemic risks, and I want to start off with a scenario that's becoming increasingly less hypothetical every day. So imagine a large language model known as an LLM being trained on genomic and clinical trial datasets from around the world. It generates a novel biomarker prediction that looks very promising. And of course, you can imagine the days that follow, there'll be headline news around the world showing that the promise of AI is in fact real. But when you dig a bit deeper, you'll find that the data that it relied on disproportionately came from certain settings around the world. And usually it's from, maybe in this scenario, I'm giving you under-resourced settings. And you'll find that the communities there never gave the informed consent. They're unaware that their data sets were even used in this rapid evaluation and in this pattern finding by the AI algorithm. There was the model's outputs also, when it's eventually rolled out around the world, it underperforms in settings around the world, including in some of the target settings, which may in fact be high income settings, which is usually where the money is. So all in all, you'll find that this hasn't really played out the way that it was initially thought it would. Now, this is not a story about medical error in one algorithm. This is a story about systemic risk in the whole of the research ecosystem. And that's what I want to focus on today. So I've been given the task of looking at systemic risks. Now, when I talk about systemic risks, I don't mean a risk from a single algorithm making a mistake. What I'm talking about is the risks affecting the entire research ecosystem, the way that knowledge is generated and validated and governed. That's basically what we mean by systemic risks in this context. So systemic risks are embedded in the structures. We're talking about how does data flow? Where does it flow? How does it flow across the border? How is power concentrated in just a few actors? How are models shaping and what counts as evidence? These are all what we call systemic risks. Now, these risks accumulate quietly, sometimes rapidly, but still quietly. But if they're left ungoverned, they can destabilize the very foundations of what we know today as health research. Now, I want to focus on a few specific categories of systemic risks. There are many, many systemic risks that I can focus on. All of them are important, but because of time, I want to just focus on three, and some of these have been mentioned by before me. So I want to focus first on equity. Now, much of the data that fuels health research flows in one direction. It flows from the global south to the global north. And this is a simple mathematics issue. Asia has a population of approximately just under 5 billion people, 4.8 to 4.9 billion people. There are more people in India and China than, of course, almost any other country in the world. And it's almost more than the whole of Africa put together. So these are huge data sets. So you can see that when you're drawing from these data sets from Africa, from Asia, even from Latin America, that's a huge amount of data. But the benefits, intellectual property, publications, patents, don't flow back to the global south. So you'll find that when AI enters the picture, it actually amplifies and accelerates this imbalance. And we risk reinforcing a pattern that some people have basically called data colonialism. Now, the ethical question is not just about privacy, it's not just about consent, it's about fairness and justice. And this is an epistemic risk issue related to data sovereignty and equity. The second epistemic risk I want to highlight in the brief time that I have is known as epistemic opacity. Very big, complicated word, but very simple. Now, large language models, or LLMs as they're known for short, are not designed to generate transparent causal reasoning. By their very nature, they're black boxes. They're probabilistic engines that collapse knowledge into patterns of likelihood. So they find patterns from huge data sets, and you'll find that health research, of course, the very foundations of health research are founded on explainability. So being able to validate and verify something, you can have a confirmatory trial. You can test this, of course, in different ways, and you validate whether this is in fact really true or not. But you'll find that when we normalize black box outputs, in other words, algorithms that don't really explain how they arrived at their analysis, this creates a major problem. Because if we basically have black box algorithms making findings, we risk building science on sand without knowing what's actually under the sand. And if we normalize black box outputs today, we risk and also not know, we don't really know how will we validate science outputs in the future if this is going to become increasingly prevalent. So as I said, science is based on being able to validate and replicate. But if we don't know how this answer was being, how this answer was determined, how do we validate and verify that? This is part of the problem with algorithmic opacity. We don't really know how the algorithm is making its decision. And of course, developers very often don't provide that type of information. So this is a major systemic risk. And we know that, as I said, is known as epistemic opacity. The third is concentration of power. It's another systemic problem. Now, these are the resources to build frontier AI models. In other words, you compute, you provide data access, and of course, you get access to data. There's engineering talent, which of course we know that we've got countries in the room here that have some of the best talents in the world. We've got people from India in the room. Some of the best computational and engineering talent come from those settings. But they've concentrated very much in certain companies in certain states. So of course, you find that certain states in India in particular are a huge feeder for Silicon Valley. They help to drive and develop, and they're the engineers that build AI systems. Now, the problem is that while they may come from certain settings, they create these settings and then create these systems, but in certain settings only. And this gives disproportionate influence over the research agenda itself. So some of you may have seen the news a few days ago where, it was almost unbelievable news where, OpenAI or ChatGPT's developer was basically saying, our engineers are being approached by Meta, and they're being offered huge signing bonuses of $100 million. And that's excluding their ongoing payments. Clearly all of us are in the wrong business here if you're getting $100 million signing bonuses. But what this does is you've got all these concentrations of power where different multinationals are now, of course, becoming huge purveyors of data, but also the power is concentrated in them. So they get to decide, of course, what gets prioritized for research. What do the algorithms get used for? So which diseases get prioritized? Do we look at malaria, HIV, TB, or do we look at, for example, maybe develop diseases that are quite prevalent in North America? Which populations are worth training on? Without governance, we risk the research not being steered by public health priorities, but of course by commercial or geopolitical ones. So this is a major, major epistemic risk. And again, that's relation to concentration of power. I want to spend a very brief couple minutes or two looking at governance pathways and ethics anchors. So what do we do? Now, in the work that we do at the WHO in the AI governance work that the working group is looking at, we're looking at developing global guidance documents. And one theme that has come up consistently in all our guidance documents and in, of course, in our feedback from the members is governance must precede deployment. It must not lag behind deployment. Now, of course, these are important factors, but they're levers, three levers that I think are particularly important when we're looking at governance. And we're trying to govern AI, and especially govern AI in the use and in the conduct of research. Number one is transparency and auditability. We need standards that researchers need to know. They need to know what standards apply to them. They need to disclose, and they need to disclose what data went into the model, what biases it may carry, and how that biases and how was that output validated. So you've got all these answers being generated, but how is it validated? How did they validate it before it actually became a finding? The second one, besides transparency and auditability, is ethical safeguards for data use. So consent can't be symbolic. Representativeness cannot be optional. You'll find that benefit sharing must be designed into research partnerships, and it must not be treated as an afterthought. After the data sets are mined, then we're talking about, okay, so how do we get these yields back to India? How do we get it back to Africa or Latin America? It's too late then, because by then the prices have been set. We need to, of course, have ethical safeguards for data use right from the very outset. And you'll find that representativeness can't be optional. We need to make sure that it's built into the research partnership right at the very outset. And lastly, it's shared global standards. We can't have different standards applying to different places. Australia can't have a different set of standards from India, from South Africa, from the US, from Canada. We need to have a similar types of standards. So you find that countries around the world need to ensure that they have harmonized standards. And this is where the WHO's work becomes quite important as, in a sense, the global coordinator of global health. We need converging global norms, especially to protect low and middle income country settings from exploitative practices. So in closing, just a remark or two, I think the risk is not simply that AI will get things wrong. It may actually get things right. The deeper systemic risk is that our research ecosystem might quietly normalize opacity, inequity, and dependency. And that would be a future in which science itself becomes less trustworthy and less just and less effective. Now, this, of course, as we know, is being amplified already with social media misinformation, AI underpinned generative misinformation. So you'll find that this is ways that you find that if we don't get things right now, right at the outset, we're going to in fact build and normalize opacity and inexplainability, inequity, and dependency. So I'll leave you with one question for discussion. What forms of accountability should we make mandatory before AI reshapes evidence base for health research? And I'll stop there. Thank you for your time.
Thank you, Jerome. Like, really good question to end your keynote with, makes us think. We don't have a lot of time, so we'll try to answer as much of the questions in Q&A. We'll probably go a bit over if it's okay with the panelists, but totally understand if you have something else. So I have a question for Jerome. As a research organization, should we prioritize skills like technically doing research, critical thinking, or other considerations like environmental, social, economic conditions that the use of AI implicates, versus also the outputs like academic, commercial kind of outputs, which make the job of researchers very efficient? Any thoughts on this? And this is one of the questions that came during the registrations. Any thoughts?
Now, the WHO is currently putting together another follow-up guideline. I think this is the third or fourth one that the working group is putting out now and being coordinated by a really good colleague of mine, Rohit. But essentially, I think, what we've realized when we're looking at the latest guidance document, looking at AI and research or health research, and looking at the ethics of that, is that there are many different domains. So, it's not just one issue. It's the use of AI to conduct research. It's the use of AI to review research. It's the use of AI to do so many different things in the research ecosystem. The research ecosystem is quite complex. You can use AI to accelerate research. So I think, what we've realized as we're putting together a guidance document is that almost each of these different issues needs its own set of guidance. And that's more or less what's been happening now, is that we've realized, do we have a set of guidance documents to basically say whether it's acceptable to use AI to write your research paper or to review your research if it's, for example, a research ethics committee. So I think, when you're talking about this, there's not one size fits all or one answer for the entire ecosystem. I think, you've got to have a set of standards and a set of norms, acceptable norms and universal norms for each of these different areas. So if you're a researcher looking at this just at the grassroots level, if you're a researcher using AI to conduct research, you need to understand that the ethical importance there is to ensure that you are able to explain and that your research can be replicated. I think if you are using AI to help review research, you yourself have actually gone through the document and you've actually verified that AI has not missed anything, has not, for example, overemphasized or oversimplified something. Because as you know, if you go into almost any of the generative AI chatbots, it says at the bottom, for example, ChatGPT can make mistakes. So if you're relying on an AI tool to help review or to help write up something, have you verified that in fact what it's generating is in fact correct or is in fact complete and not something that's a misrepresentation? So, it's a very simple answer and it doesn't answer your very good question. But I think that there are many, many parts of the research ecosystem that AI can be applied to, from reviewing databases very quickly, far faster than what humans can do it, to of course also just generating an answer. But we just need to make sure that whichever way you are intersecting with the ecosystem, that you understand that there needs to be some sort of accountability and that there's a human element in overseeing all of that. And you're not just making this an autonomous process without any sort of intervention or interrogation of the output.
Thank you, Jerome. We just have 2 minutes more, so not taking any questions. But I have a quick question for Dr. Mathur. You developed the ICMR guidelines in 2023, and it's almost 1.5, 2 years, I believe. Any quick learnings around the process on what we can do better? How can researchers do better? How can ethics committee members do better? How can everyone else in the research ecosystem do better? A quick question, thought.
Well, very quickly, I would just say that the ICMR guidelines, generally people who are working in the medical sphere refer to the guidelines and try to employ them. But the biggest challenge that we see here is that there are developers who are out of the domain of medical research, who are actually the ones who are developing AI tools, and because again, ICMR guidelines is a guideline. It's not a regulatory requirement. And so there is a lot of need for dissemination. And I thank you for holding this, this webinar and also giving me the opportunity to speak, because we need to widely disseminate the guidelines. We were thinking about revising, but we found that it has not yet been used as much as we would really want the document to be used, so that we get enough feedback on the basis of which we could plan a revision. So I think dissemination because AI, we are dealing with interdisciplinary work here. So it is a little bit challenging in trying to implement the guidelines. Thank you.
Okay. Thank you, Dr. Mathur. Really good insights, and that actually creates more work for Marinke and me to make it more interdisciplinary. Really great diverse points, and thank you so much to the panelists and also to around 180 or maybe 200 people. I don't know how many joined in the hubs in other places. So thank you so much, and really great insightful talk. And thank you. Have a good day, good evening, good night, and thank you.